Welcome to this LEX18 Digital Conversation. I'm Davidson. Diabetes affects both the young and seniors and crosses all racial lines. It is a disease where a person's blood glucose or blood sugar levels are too high. Glucose, of course, comes from the food that we eat, and insulin is a hormone that helps that glucose get into your cells to give them the energy. Here in the Bluegrass, UK Health is leading the way in research, treatment, and education. Joining me to talk more about the Barnstable Brown Diabetes Center is Laura Hieronymus. Welcome.
Thank you.
Let's talk a little bit about this. This is a big issue here in the Commonwealth, and to have this center is a big deal.
It is a big deal. Actually, in Kentucky, better than 15% of our adult population have diabetes. That compares with the national incidence of 9.4%.
Wow. Is it dietary? Is it heredity? Is it a combination of both?
It's a combination of both. The genetics, the heredity is something you really can't change.
Right.
Age is also a risk factor. So as you get older, your chances go up. For example, individuals 65 and older, 1 out of 4 have type 2 diabetes.
Wow.
So something to keep in mind. Sedentary lifestyle and maybe overeating contribute to type 2 diabetes as well. Those are things you can change, and those are things that we work with individuals at risk for diabetes to try and prevent.
Well, let's talk a little bit about the center. Barnstable Brown, we hear that name, especially during Derby time, when we talk about the Derby Eve, ball and all of the celebs that come into town. This is actually seeing the fruits of that labor, isn't it?
Absolutely. The funding from the party, so to speak, the funding allows us and has allowed us to develop the Barnstable Brown Diabetes Center. We have about 22,000 square feet. We're over in the Turfland area, which is a great place in terms of access and parking and so forth.
The old Turfland Mall?
The old Turfland Mall.
Really?
Right, right.
So is this the center that people can just kind of come in and say, hey, I'm pre-diabetic, or I have a parent who is diabetic and I'm concerned, or is this something that you have to be referred to by your physician?
We take both. We take both. So our center, the Barnstable Brown Diabetes Center, is a comprehensive care center. We focus on prevention, education, clinical care, as well as the research projects.
Clinical care being?
We have an adult and a pediatric diabetes and related disorders endocrinology clinics. And so we see about 2,500 pediatric patients. We have about 2,500 pediatric patients at our pediatric diabetes clinic.
So many children.
And about 7,500 adults.
Wow. As a parent, what can we do to help our children to not fall through the cracks and have to deal with it? Because this is a lifelong and life-altering disease.
It is. So type 1 diabetes is actually the more common diabetes in children. And as of yet, we really don't have prevention for that. We can screen children's siblings to see if they might be at risk, but we don't have a prevention project specifically to really prevent that disease. There are some things we can do. Now for type 2, which is becoming more and more common in children, yes, we can work with the families and the individuals to try to minimize the effects of type 2 diabetes and to treat it in a manner that will improve the health of the child with type 2.
Is this something, when I think about diabetes, I think of people having to take insulin shots. Is it always shots, or are there tablets or pills, or is there some type of other treatment?
Well, let's scoot back and talk about individuals at risk for type 2 diabetes. And many times those individuals will have pre-diabetes.
Yes.
So pre-diabetes is a type of diabetes when your blood glucose levels are higher than normal range, but not quite high enough to get a diagnosis of type 2 diabetes. So we can work with individuals with intensive lifestyle management. We have a 12-month diabetes prevention program, and it really focuses on changing lifestyle, and in addition to that, problem solving and troubleshooting and behavior change so that individuals can reduce their risk for type 2 diabetes. At least prevent,
Right.
excuse me, at least delay,
Delay, exactly.
if not prevent,
Prevent it.
type 2 diabetes.
Right.
If individuals with prediabetes don't do something, they'll likely develop type 2 diabetes in 5 to 10 years.
Oh, really? That quickly?
Very quickly.
Wow. But then going back to, are we talking insulin shots? Is this something that you have to prick your finger and monitor? I mean, what do we do?
So when you have type 1 diabetes, you do need to take insulin. So with type 1 diabetes, the individual makes very little to no insulin.
Right.
Insulin's a hormone, and so it's a manufactured hormone that you can't swallow. If you were to swallow it, it wouldn't do you any good. The body would break it down. So it's very important that we inject it just under the skin,
Right.
so that then the body can absorb it and utilize it to lower blood glucose levels.
Wow.
It can be delivered with injections. We also have a large number of individuals that are on insulin pump therapy, which is a little pump that continuously pushes insulin under the skin.
What, it kind of monitors when your levels fluctuate and then it just kind of gives you a little boost?
Well, no, you kind of have to have settings for it. You do have to have settings for it. So you have a 24-hour setting with small amounts delivered, and that's calculated, based on certain factors. And then you can actually push and put insulin into the system to cover the food that you eat with meals and or snacks.
Right.
There is continuous glucose monitoring, and there's a pump systems that work directly with that. They provide feedback and continuous glucose monitoring, glucose numbers based on your interstitial fluid,
Exactly.
your tissue fluid.
Fluid, exactly. A lot of times we think, or sometimes physicians, medical individuals think, when, especially an African American comes in, the first question, are you diabetic? And if you say have something like hypoglycemia, you have to always stress it's non-diabetic hypoglycemia. And they're two very different things,
very
because if
different
you gave a hypoglycemic sugar, insulin, that would send them into shock, where they would need the higher protein. How can the community help to not only be self-aware, but to help their physician, or when they go to the hospital or they need some type of treatment, to help individuals understand that there is a distinct difference, and to sort of say, hey, don't lump me into one category. Help me to know the difference.
Well, I think the key is recognizing your risk for diabetes.
Right.
All right. And so when you go into your primary care provider, your endocrinologist, if you go to one, you've likely already been diagnosed.
Right.
So your primary care provider is the one that is going to be taking that information. So obviously they'll have information about your race. Some races have a higher incidence of type 2 diabetes. The other thing that's really important is to make sure that you communicate your family history of diabetes. Because it's a genetic disorder. There is no it skips generations. That used to be an old myth, that it skips generations. It doesn't necessarily.
Oh, wow.
All right. If you have one parent with type 2 diabetes, you've got a 30 to 50% chance of developing it. If you have a sibling, another thing to communicate, you've got about a 50% chance of developing type 2. So it's just extremely important, and we would like, working with primary care physicians, to identify when you have pre-diabetes, when there's something that we can do to prevent or delay type 2, rather than wait until you've got diabetes.
Exactly.
Although we still want to know early,
Right.
because about a third of the type 2 population doesn't know they have it.
Oh, you're kidding.
No. Symptoms don't usually occur until the blood glucose levels get at much higher levels.
So but somebody would pass out, or what would be
So
sort of
the symptoms of hyperglycemia, which is the hallmark of diabetes, any type of diabetes, are being thirsty, urinating a lot, going to the bathroom a lot. Fatigue is another common symptom. Blurry vision, dry mouth. Some people may have a headache along with that. Some people just sort of, kind of pass those symptoms off and blame it on something else.
Sure.
So bringing those types of symptoms to the attention of your primary care provider is extremely important.
Right.
So that they can run blood testing, lab testing, and see if you meet the criteria for type 2 diabetes.
Because so often we see individuals lose limbs, fingers, things of this nature because of this condition.
And that's another thing that we want to prevent.
Yes.
So when someone has diabetes, you mentioned insulin injections. Many people with type 2 diabetes also take insulin injections. It's not usually first-line therapy, meaning where you start.
Right.
So we do have oral anti-hyperglycemics that can help to lower blood glucose. We have a number of them now. We also have other injectables that we can use that help the body control the blood glucose levels.
Wow. So lots of research going on at the Barnstable Brown Center. Anything exciting that you want to share?
Well, I think the thing to keep in mind is that we do a lot of research around pre-diabetes and diabetes across the enterprise.
Right.
And so we at the Barnstable Brown Diabetes Center want to be a leader with that research. So often we'll investigate with different entities across the enterprise, in addition to having our own research studies. We just completed a little pilot study looking at primary care physicians' referrals to our Barnstable Brown Diabetes Center education services.
How is that going?
So we have a diabetes prevention program, and we found that if there were if the physicians had a physician champion in family and community medicine, if they had someone that provided them with information and worked with them to identify this population, that the referrals
go
went
up. So it's all about knowledge, huh?
It is, it is, it is.
Wow. Well,
so speaking of knowledge,
yes.
I will have to mention our freestanding diabetes education services.
Okay.
First off, we have a number of diabetes educators across the enterprise. We have in our 2 clinics, if you come to either our adult diabetes or our pediatric diabetes clinics, we have diabetes educators that are assigned there that work with individuals. We also have diabetes educators at UK Healthcare that are affiliated with Barnstable Brown Diabetes Center. So they would see you if you had diabetes and a consult was made. They would see you in the hospital setting.
Oh, wow.
So,
but now what about going out into, say, some of the more rural areas?
Well, so we have our diabetes education freestanding. So if you have a primary care physician and your primary care physician says you've got either pre-diabetes, you've got type 2 diabetes, you're newly diagnosed with some form of diabetes, they could refer you, and we could work with your primary care physician in the outpatient setting to work with them.
Oh, wow.
So they treat your diabetes, and we help with the education component. In fact, diabetes education is an essential part of the diabetes care. So much so that medical treatment without it is considered inadequate. So you've got to be educated on what to do, how to troubleshoot, how to problem solve, and how to reduce the risk for those complications that you mentioned earlier.
Well, now this is something that I guess would be the whole family. Even for an adult, you would need whoever is your partner, your whoever, to be involved in this education process too. Because if you say hit crisis, people need to know what to do, right?
You're absolutely right, and it really is and should be a family endeavor, because we don't ask our patients to not do certain things. It's not like don't do this, don't do that. We work with them on helping us determine what is the best plan that meets your needs. And also, of course, we look at your lab results and so forth, so that we can make sure that what you're doing and what we're helping you do is helping those labs to improve. So that's really important. For kids, family support is extremely important. Data show that kids who have diabetes that have the best family support often have the best outcomes. For individuals with type 2 diabetes, for example, the genetic component's there. So if someone's middle-aged and they're newly diagnosed and maybe they still have some kids at home, those kids are at risk for type 2 diabetes. So there's no reason not to, implement that plan for the whole family.
Well, now, insurance is a big thing, because when we're talking about this is an expensive endeavor for some individuals, especially those who are uninsured or underinsured. Are there any stopgaps in place to help people who may fall through the gap?
Well, that's a really good point. That's a long conversation. But I think the short story is that most individuals, if they have some sort of medical coverage, they can get good medical care.
Okay.
And then we work with them from the education standpoint. The diabetes prevention program is fairly new,
Right.
just in terms of the U.S.-wide
Right.
endeavor for that. So many insurances are signing on to cover that. Medicare started covering April 2018, so we have coverage for that.
good.
Diabetes education services are generally covered
Okay.
across most insurance plans. We also at UK Healthcare, and I'm sure other healthcare systems and the health department works with individuals who need financial assistance.
Good.
So, that's always an option, I believe, if the individual is struggling.
Exactly, because we don't want anyone to fall through the gap.
We do not want people to fall through the cracks.
Well, it's good to meet you, good to talk to you, and thank you for watching this LEX18 Digital Conversation. For more, just log on to our website, lex18.com. Until next time, I'm Dia Davidson.